Good evening and welcome to the news. First, let's take a look at the headlines. Meghalaya registers 809 new cases with 597 new recoveries and 12 fatalities. Amidst surge in COVID-19 cases, government to organize special prayer, informs Health Minister A.L. Hegg. East Shillong MLA Ambereen Lyngdoh sets up a Corona Care Center in Nadimkra, urges 59 other MLAs to follow in her footsteps. And relief rescue operations underway as cyclone leaves a trail of destruction in Odisha and West Bengal. The news in detail. Meghalaya reported 809 new cases today, taking the total active cases to 8,255, and in the last 24 hours, 12 people have succumbed to the virus, taking the death toll to 524. 597 people have recovered from the virus today. India is witnessing a declining trend in the active number of coronavirus cases, and the recovery rate is continuously improving. The Union Health Ministry said the recovery rate has crossed 90% today. So far, over 2.46 crore patients have already recovered from the disease. The ministry said there are over 24,19,000 active cases in the country at present. The health ministry said a total of 3,847 deaths were reported in the country within the last 24 hours, taking the toll to over 3,15,000 across the country. Amidst this second wave of the COVID-19 pandemic, Meghalaya government has decided to organize a special prayer on May 30th. Informing this, Health Minister Alexander Lalu Hegg told reporters that he has suggested the need for the government to organize a special prayer in a discussion held with Chief Minister Conrad K. Sangma. The government has decided to organize the prayer at 12 noon on Sunday, and Hegg has urged all citizens of the state to join hands with the government in praying.
We should have a special prayer. So already we have decided that we will be having on this coming Sunday, that is on the 30th of May 2021. We have told that by 12 o'clock sharp, everybody in their own respective places, own houses, their family members, they will be assembled at 12 o'clock sharp. They will start praying and ask our Almighty for our protection.
Congress MLA from East Shillong, Ambereen Lyngdoh, urged the 59 other MLAs to follow in her footsteps by setting up a Corona Care Center to cater to the people of their constituencies. Lyngdoh has set up a Corona Care Center for isolation and treatment of COVID patients from Latjamkra area. She informs that all expenses to run the center will be borne by her along with the support of her family members. She has also got a young doctor who is willing to help her in taking care of the COVID-19 patients in the center. This move of the MLA comes at a time when the state is facing shortage of hospital beds. She has stated that the community should not stigmatize COVID-19 patients, adding that people are refusing to come forward for the testing if the deceased is tested positive due to fear of being stigmatized. During a time when the state continues to be under the grip of the second wave of COVID-19, a group of citizens residing in the Ferndale apartment complex in Shillong have organized themselves to form what can be described as a model community response. Here's a report.
Much like the rest of East Khasi Hills district, the Ferndale apartment complex located in Secretariat Hills was also hit by the second wave of COVID-19. What makes this group of residents stand apart is their response to such a challenge.
We feel that this is coming. So our leadership of Ferndale Apartment Society, the executive committee, they have constituted a Ferndale COVID-19 task force to take necessary measures and to be prepared for to fight with this virus.
This is a war, and like any war, those who are prepared, if we are prepared, then we have a chance of winning. If we are not prepared, then the consequences naturally will be quite large.
In addition to the manpower mobilized, the community has also procured for itself necessities such as sanitizers, PPE kits and even oxygen cylinders. Not content with the current level of preparedness, the Ferndale Apartment COVID-19 Response Task Force has also placed orders for oxygen concentrators. Their response is not limited to medical and sanitary interventions but employs a holistic approach.
What we did, in fact, we want to minimize the exposure of people going from here to the nearby shops, because that may be a hub of transmission. And also we want the many vendors to come in from outside, anybody comes and sells. So we have tied up, as per the district administration's list of vendors they have given who does home delivery, we have tied up with some vendors, and sometimes we order online, and sometimes we invite particular vendor to come. The idea is that everybody gets business, you know.
We as a society, we always want to help any downtrodden people or any people in need, and very often the ladies wing accumulate, and suppose our house is under quarantine, we get vegetables for them, and whatever medicine or anything they need, we try to help them out.
The residents of Ferndale have also managed to have a significant vaccination coverage in their apartment complex. While encouraging more communities to set up similar initiatives, they also insist on getting vaccinated so that the pandemic may finally be defeated. Bureau Report, DD News, Meghalaya.
Congress MLA Ampareen Lyngdoh has highlighted areas of the COVID-19 pandemic management where the current government response has been found lacking. She has mentioned the slow pace with which care centers are being set up, issues with providing essentials to those under containment, and the closing time of pharmacies are some areas where the government needs to give serious attention. She also mentions that despite such drawbacks, during a crisis it is important that one cooperates and works hand in hand with the government and not simply sit back and condemn it.
I think government has to speed up. It didn't take long for me and MLA to actually start a center. So I don't think procedures and processing of action to be taken should not take so long. The other thing is I know that those under containment or under home quarantine are not getting essential supplies. This patient kit that everybody is talking about, again we saw the health secretary talk about it again. None of my patients are getting this kit. There are no medicines given to them.
In Odisha, district administration of the cyclone-hit areas have stepped up their relief and restoration efforts. While road communication in many parts of the affected areas in North Odisha have been restored, works related to the electricity and water supply are also in full swing. In West Bengal, after the severe cyclone Yas, high tide due to the full moon or Purnima further damaged low-lying coastal areas last night. Rivers were swollen and resulted in inundation of areas further. People were advised to stay at relief centers and not to return to their homes. Disaster management personnel are engaged in rescue and relief operations. In places where the water level has been reduced, inmates were seen trying to save their belongings and head towards relief centers. Another weather report. The maximum temperature recorded was 23.6 degrees Celsius and the minimum temperature was 17.9 degrees Celsius. Relative humidity in the morning was 79%, while in the evening was 65%. Forecast: moderate rain or thundershowers is very likely to occur at most places. Our news bulletin is also available live on our YouTube channel. In addition to watching on television, viewers may visit the DD News Shillong YouTube channel to tune in to our daily bulletin. Before we wind up, here are the headlines once again. Meghalaya registers 809 new cases with 597 new recoveries and 12 fatalities. Amidst surge in COVID-19 cases, government to organize special prayer, informs Health Minister A.L. Hegg. East Shillong MLA Ampurin Lingdo sets up a Corona Care Centre in Laidankra, urges 59 other MLAs to follow in her footsteps. And relief rescue operations underway as cyclone leaves trail of destruction in Odisha and West Bengal. The battle against COVID-19 is not over yet. Wear mask, maintain social distancing and wash hands frequently. That's all we have in the news. Until we meet tomorrow at the same time, same channel. Thank you and good night.